Great. I would now like to welcome and introduce Gift Aldridge, who is our Tocqueville Society Chair again this year. He is fabulous to continue his leadership, and we're excited to have him for another year. He has served in several capacities through the years as board member and on the campaign cabinet, and he's been a wonderful advocate in the workplace as well. Gift spent 39 years at Nucor Steel, and he retired 2 years ago. He's now enjoying consulting with manufacturing leadership groups on safety and leadership, traveling, and spending time with his family. Giff, I'm now going to turn it over to you, and thank you for being here today.
I'm not going to say anything else about me because you'll think less of me after that introduction. So I'm just going to leave that right there. Hey, but thanks everybody for being here. This is really fantastic of you. As much as United Way loves your generosity, they also respect your time. So we'll move along. I'll get us over to DJ pretty quick here. But again, just thank you very much for being here. I'm very happy to be the Tocqueville chair again this year, and hopefully we can continue to make some great gains, particularly as we transition to the mission you're going to hear more about today. And so with that, I'll introduce DJ. He's in the last 18 months. I hope all of you felt it the same way I have. The ideas and energy that DJ's brought, I think, it's been just very beneficial. And then again, we're transforming in the middle of this. It'll take everyone's support to do that, but I think it's an exciting time. And the only thing I'd like to say before turning it over to DJ is one, ma'am, please get your questions and answers. This really is about your time and getting everybody as knowledgeable and educated as we can. So the more we make use of the Q&A at the end of this, the better this call will be. So again, we get some value out of the investment of your time. So again, very excited. Thanks so much for being on today. And DJ.
Thanks, Giff. And hello, everyone. It's so good to see you. Apologies if you're seeing some folks walking around behind me. I'm at the county council's office. We have a campaign event here right after for all of the city employees. And so if you see some folks missing the elevator behind me, apologies in advance. Really glad to see you all. We've had a chance over the last year or so to sit down with almost every one of you on this call. And so I want to say thank you. What you've been able to share over the last year as to what you see as the community's needs, but also help give us feedback as to how we adapt to these times that have shifted. And what I'm really excited to share with you all is I know when we last connected, we were kind of talking about 4 big areas that United Way could focus on, all very critical to the future of our community. And I wanted to share with you all here that our board recently, in the last board meeting, decided to go all in on family financial stability. And so if you think about those 4 buckets we were looking at, really looking at households that are ALICE, that have a child in the home. And when we step back and look at the data, we know about 30,000 houses in the Tri-County fall into that bucket. And so now we're stepping back and saying, how do we now move forward in a thoughtful way with our nonprofit agency partners, in collaboration with the community and our donors, to really lift up? A lot of it will be building on the work we already have, which is the Resource Connection Centers, 211, taking some of our programs and figuring out how we bring those Resource Connection Centers right to those ALICE families where they are, where they work, where they pray, where they learn, but also thinking through what does it mean to case manage at a much deeper level than simply out of crisis. It does us no good to get someone from a place of financial insecurity to somewhat stable, only to fall right back down because the costs here are just too much. I won't give away any of the new data that Katie and others are going to be sharing with you in just a few minutes, but I got to say it is probably the calling of our time is how do we make sure that neighbors are able to stay, that are able to work, are able to thrive, their children can stay and continue to learn, so that this Charleston that we all know and love in this Tri-County area can continue to prosper for many, many years. And I just wanted to say thank you to all of you. I'm looking through the Brady Bunch view here, and almost every one of you provided feedback, insights, and the ALICE report that you're about to hear really does zero in on those families that we'll be talking about. And so I'll just pause here and say, any questions for me before we move on to the next piece and I get out of the way so we can talk about the data? Okay. Hearing none, I will hand this back to Katie and Louise for the next set. And again, thank you all for the work that you've been doing and leading and for your generous support of your time, your talent, your treasure. Thank you so much. Katie, Louise?
Yeah, I think now we're going to shift to Bridget, our fantastic new CAO. We're so excited about her work here in the new space. So she's going to talk a little bit more about that new, that new vision and how we're going to integrate that into the work of this single focus. Bridget?
Thanks, Katie. Hello, everybody. I'm Bridget Laird. I'm the new Chief Advancement Officer here. I'm so new that I don't have my headshot. You saw everybody had their United Way headshot. Getting that on Friday, so I'll have that soon. But super excited to meet you all in person. I've been here, like I said, I'm coming up on 2 weeks, so just enough to be dangerous and learn about all the great stuff that we have going on here. To provide just a little bit of context to what Katie will be talking about soon, in terms of ALICE, last year, the Trident United Way brought United to ALICE to South Carolina. And it's grown into a statewide initiative that involves partnerships with 4 other local United Ways. So together, we're working to convene, advocate, and collaborate on solutions that promote financial stability at local, state, and national levels. When I first got here, I thought that that was very cool that we're taking the lead within the state at the Trident United Way. With more than 4 in 10,000, more than 4 in 10,000 and 10 households in South Carolina are unable to stretch their income to meet their household needs. So we understand that the work is more crucial than ever. Just a reminder, ALICE, there's a lot of acronyms I'm finding here at Trident United Way. ALICE households are asset limited, there's your A. Actually, asset, your A. Limited is your L, income is your I. So asset, limited, income. The C is constrained and the E is employed. So we know that people that have ALICE households and have children within them, the children are growing up in financial hardship. So that's one of the things that Katie's going to talk about here in the report. We recently released a new report that is focusing on the children. So there was a report that came out earlier that was just about ALICE households. This is now focusing on children under 18 growing up in financially insecure households. So Katie is super energetic, the most knowledgeable person in the state for ALICE because she is the statewide director of the ALICE initiative. So she's going to walk through this most recent report and give us all of the details.
Thanks so much, Bridget. I really appreciate that. As Bridget mentioned, this is a statewide initiative. This is kind of the one thing that as I talk with all of our 14 local United Ways that hang out with us and do this, this is our one group project. And I like that. One of the things that we talk a lot about is our clients and the residents that we help in the state of South Carolina. They really don't care what United Way you are. They just don't. They are not worried if you are the United Way of Florence County, Low Country United Way, United Way of Oconee County, or Trident United Way. That is not concerning to them. They are not concerned with what logo you have or what's in front of your name. All they want to know is, can you help them? And this enables us to have that conversation, enables us to get resources and have those conversations with legislators, with our private businesses, and really start to have those in-depth conversations about what circumstances are happening in households that don't enable them to become financially secure. And so that's what we're really going to talk about today. I know that some of you have been at like every ALICE thing that we've ever talked about. And some of you are like, I don't even know what this lady's talking about. So we're going to do a little bit of brief overview to make sure everybody's on the same page today. But we're primarily going to focus on, as Bridget said, this ALICE in Focus Children Report. And that released with us just a couple of days ago. And the goal of this report is to really focus in on what are those impacts on the households with children? How does that directly impact those kiddos? And what does that look like long-term, both for those children, those households, and then us as a state as a whole? Okay. Again, we really do invite you to put any questions in the chat box, or we will have time for question and answer kind of as we start to wrap up at the end. So you're welcome to just unmute them and ask your questions as we go through. So I'm going to start kind of walking through this data and provide just some context for it as well. As much as numbers matter, and I am very into fact-based decision making, I also recognize that the context matters, right? You can throw a lot of numbers out there, but how does that apply regionally and locally for us here in our Tri-County region matters as well. So we're going to walk through that too. Okay, so we're going to walk through exactly what Bridget started to kind of discuss earlier is what does ALICE even mean? So ALICE is an acronym for Asset Limited, Income Constrained, Employed, meaning households that are receiving some form of income into their household. Often that means that household has some adult in the household that is employed and income is coming through that way. But it can also be that income is coming through in that household through Social Security, disability, or retirement. So we just know that income is coming into that household that pops that household up above the federal poverty line from an income perspective, but they often are not able to meet basic needs per month. Okay, so that means often living paycheck to paycheck, income to income, meaning whatever's coming in barely covers it. When emergencies happen, it hits them incredibly hard. They often slide into spaces of facing eviction, unable to meet those crises, losing things like their transportation, going into debt and facing incredible debt for medical bills. Those types of scenarios are happening. Okay. Any questions so far? And I'm going to pause a little bit as I go through this because I want to make sure we're on the same page. Any questions so far? Okay, we'll keep rolling then. So what does that look like in South Carolina? So in South Carolina, there are 2.1 million households. So you'll hear us talk a lot about households in general. And what that means is that households can be any combination of things. So a household can be one single individual in a household, or a household could be 5 college students living downtown trying to make it work and eating their parents out of house and home. Or a household could be 2 seniors living together, or it could be 2 married adults with 3 children. Household composition really matters though, because we know depending on who is living in your household, it changes what your bills are. We know that if you are a senior living in a household, that often your medical expenses are a little higher than if you are in your 20s working at a job that is supplying you an employer-based healthcare plan. We also know if you've got kiddos in the household, your food costs and your child care costs are much higher than other households, right? So we know that that household composition matters. So as we will go through this conversation, we're talking about households, and those numbers will change based on who lives in the household and change based on where that household is located. That is different than the federal poverty level. The federal poverty line in the United States does not change regionally. So for those of you that may have lived somewhere else, whether you were in, let's say, California, or whether you were in the Northeast, maybe up in Connecticut, or down here in the South, all of that, the federal poverty level is the same. And as you know, if you've lived anywhere else, costs are real different, y'all. It is very different depending on where you live. And unfortunately, the federal poverty line does not allow for that. So we find that to be really important to recognize. So in South Carolina, 44% of the 2.1 million households, or 239,833 households, are living on the verge of financial instability and facing that instability and struggling to make ends meet. 44% of households. Then when we look at children specifically, that number drastically increases. So again, of the 1.1 million children in South Carolina, 53% of those children are growing up in households with financial insecurity. Again, that's 53% of the children. Okay, questions so far? How are we doing? Okay so far? Okay, I'm seeing nods, so I'm going to keep going. So what I want to be clear about is when we talk about ALICE, we're really talking about the ALICE threshold. We often get this question as United Ways, and we want to be clear about this. The 15 total United Ways that are involved in the ALICE initiative statewide have always been and will always continue to serve and work with households that fall at or below the federal poverty level. We are not stopping that work. We are not moving away from that work. We will continue in that space. We are just expanding our conversation in a data-driven way. We were already serving lots of households in the ALICE category, so above that federal poverty line. We just did not really have the data sets to kind of make those fact-based decisions and put it in grants and talk about it in this larger data-driven way. But now that we do, it's really helpful to us. And when we talk about ALICE, we're really talking about the ALICE threshold, which is the households that are living in poverty plus those in that ALICE category. And you can see that here. You can see that combination here with the ALICE households, which is at 34% for kiddos in South Carolina, plus the 19% of households with kids in it that live in poverty in South Carolina. Make sense so far? I would also add that in South Carolina, 30% of the kiddos under the age of 6 live in poverty. So you're more likely, and we'll hit that data point again in a minute, more likely to live in poverty the younger you are as a child.
And Katie, apologies for interrupting.
Yeah,
Meryl had
please
a
go
great
ahead, DJ.
question around what is the actual current federal poverty line that we're talking about?
Go ahead, DJ. Yep. So that's
So-
great. Yes, the federal poverty line, the dollar amount is right about, it's actually a tiny bit higher than 30,000 now, DJ. For in 2024, it's right about 36,000 for a family of 4. But we know that that same family in Charleston County for the ALICE budget, that a family with 2 working adults and 2 kids in child care, it's right at 89,000 for the survival budget for that same household in Charleston County. And we're going to walk through actually on the next screen. So that was a great time to ask that, Meryl. I liked your timing, and I promise I did not pay Meryl or slip her anything. No chocolate was slipped to her to ask this question. This is exactly how we build this. And I think, and like, it's really important to know this, guys, because I am a big advocate for, please don't believe me just because I speak with confidence. They do pay me to talk for a living, and I get out and like do the dog and pony show. But just because I say it with confidence doesn't make me right? You should question everything, and we like that people question this data. It is all state and federally recognized data. And that's really important to know. Our legislators love this stuff because they feel so confident taking these reports and going and advocating for the community with these reports because it's state and federally recognized data that they know is not going to get challenged when they go and present it in these larger settings. When they're in committees and when they're on the floor of the House or the Senate, they can present this data and feel confident about it. Now, does that mean that their method might not be challenged? Absolutely not. We don't always agree on how we solve the problem, but we are agreeing on that there is a concern and that this is the facts that back it up. So these are the buckets, if you will, that we agree that pretty much every household has to pay to survive in 2024. These are the buckets that every household is doing to basically just stay safe, dry, warm, fed with their kiddos in their household. So that's going to be the bucket of housing, which is incorporates rent and utilities, childcare, food, transportation. In South Carolina, that's the cost of operating a car because public transportation is not readily available enough in South Carolina to be a viable option for everyone to get to and from work, childcare, the grocery store, and medical options. Technology. Technology is a cell phone and broadband for adults in the family. Healthcare, and then taxes, what goes out, and then also what is going to be considered like dependent breaks and things like that. And then miscellaneous. The miscellaneous is the one tiny portion that you get kind of a little bit leeway on in this. And that's going to be things that are over kind of that overage from these other buckets. So think things that are monthly things that wouldn't be included in those spaces or over those initial buckets. So a good example of that would be hygiene items, things that you're paying monthly, or maybe you have to like fix a transmission, put 4 tires on your car, things that wouldn't be considered in those monthly expenses. Does that make sense? Okay, perfect, great. And Bruce, I see your question and I'm going to answer that one specifically in the Q&A section if you don't mind. Okay, perfect. But I do see your question. I'm going to answer. So I want to be clear about what this household survival budget does not include. The household survival budget does not include savings. It does not include retirement. It does not include student loans. And it does not include a car loan. It does not include things that build assets. It does not include saving for a down payment for a house. We know a lot of people in our Tri-County area are often spending more than what individuals that are paying a mortgage are spending for rent, but they are unable, because it's so high, they're unable to put money aside to make a down payment ultimately, right? So we're not building assets, we're just living month to month. Is that fair? Questions so far? How are we doing? Holding on? Okay. So we talked a little bit about this already, but kiddos, what does that look like? We know that it's not really equitable across the board. So while kiddos experience high rates of financial instability higher than adults in South Carolina, so we know that that is true. We also know that the younger you are, the more likely you are to live in a household that is experiencing financial instability. And you can see that here. You can see that for infants and toddlers, 60% of infants and toddlers live in ALICE households in South Carolina, versus 58% of preschool age children, and then 51% of school age children. Make sense so far? And that's wild to me. When you think about that number, that 60% of infants and toddlers in South Carolina live in financially unstable households. That is insane. And I would offer that I come from a background of working with children and families in crisis. And that's what I did for a long time before working at United Way. So I'm intimately familiar with this work. And I would offer that for any of you that maybe have been in a space where working with children and families, or have kiddos, or are an aunt or an uncle, or just any of that, like those first 4 years are so crucial. They're so crucial. The development, whether it's nutrition, whether it's the ability to spend time with them one-on-one, whether it's the ability to build those core things like counting and reading and just those one-on-one things. And we know that oftentimes our families aren't able to do those things because of the sacrifices they're having to make just to bring money into the household. Okay? So how does that look as far as public assistance goes? We get this question a lot. Like, okay, cool. Well, if people aren't making enough money, don't we have public assistance? Yes, and. There's a little bit of an and there. So in South Carolina, the SNAP program was utilized by only 59% of children or households with children in poverty. 59%. And a mere 25% of children in ALICE households. So we often get that question of, well, how come? What's that mean? Why is that? So I don't know if any of you have lived outside of the Charleston area. I often joke, having grown up in more rural spaces in the Carolinas, that sometimes Charleston is not like real South Carolina. You got to get out sometimes to have a different experience about South Carolina. I have family and have lived a good portion of my life in the upstate. That is why my accent sounds the way that it does. And we recognize that grocery stores are often a 20-30 minute drive from where you live, right? It's just not accessible. So what's the point in registering for SNAP? That is often what families experience. What's the point in registering for SNAP if there's nowhere to go? If there are no SNAP retailers within a reasonable driving distance of you, what's the point? Or if you don't have transportation, what's the point? A local food pantry is much closer to you and someone's willing to take you there. That's how you supplement. But we also recognize, and we love, I want to be really clear, we love our local food pantry partners. So many of our households are really, fortunate, and we are so fortunate to do the work we do with them. We also know that a lot of them focus on and have primarily shelf-stable foods, which limits a lot of our households from having fresh produce, fruits and vegetables, and meats in their household, which are a key, crucial part of nutrition for children. And so we know that that's a limitation. And we know that when people are living in these rural spaces, that the families have to make these decisions. But we also know the closer to resources that you live, the closer, as we would call it, you going into town, right? If you live in Oconee County, that's what you call it. You drive into town. That the closer you live into town, the more expensive it is. So what decision do you make? Do you make the decision to live closer to the grocery store? Or do you make the decision to have cheaper rent and keep your kiddos housed? But then the question comes with SNAP, right? If you're not close enough to a retailer that accepts SNAP, you just don't have it. I would also offer that in South Carolina, SNAP is only accessible through 2 ways. SNAP is accessible through an online application. So we know that lots of people don't have access to the internet, and we're going to talk about that in a minute. We also know that navigating that can be really tricky, especially for our older residents. And you can do it via DSS, in person at the DSS office, unless you're connecting with a nonprofit partner that has licensed or certified staff to help you walk through that process, which Trident United Way does have, thank goodness. But you still have to get transportation to those spaces. Does that make sense so far? Okay. Any questions on SNAP and how that works and benefits in the state of South Carolina? Okay. So we also know that there the way that racial lines are drawn out and how that looks for Alice households is also not equitable in the state of South Carolina. You are much more likely if you are a kiddo and you are Black, Hispanic, or American Indian to live in a household that is Alice or in poverty in the state of South Carolina. And that is hugely true. I mean, disproportionately true. You can see the bars here on the screen. For Black children, it is 75% of Black children live in an Alice household, 72% of American Indian children, and 66% of Hispanic children are living in households experiencing financial hardship. Make sense so far? Okay. Then we talk about household composition. We talked a little bit about that earlier, and it's incredibly important because, again, the federal poverty level doesn't really differentiate between that. It's just number of bodies living in a household for the federal poverty line. It's just like 4 people, family of 6. But we differentiate between who's living in the household because that matters. And one of the things that we know that's really important in the state of South Carolina is the number of kiddos that are living with grandparents. That is a huge percentage for us. 13% of all South Carolina children lived in a home with a grandparent, which included both multi-generational households and households where grandparents were raising grandchildren on their own. And nearly 2/3 or 64% of children in these households were below the Alice threshold. What we're going to talk about in a few minutes when we talk about the Changemaker grants is why that's really important in South Carolina. But we're going to talk a little bit about kinship care. And kinship care in South Carolina is when a child is living is involved in the DSS system. And when kiddos are pulled out of their home, involved in the DSS system, the first thing that DSS does is reach out to family and or friends to see if they can be placed in that environment. That is the preferred placement for DSS. I would also offer that while that is the preferred placement in DSS, there is no financial support that comes along with that for those families at all. They do not get SNAP, they do not get Medicaid, they do not get any financial assistance, and they do not get the clothing stipend that foster families get. So, that being said, what we recognize is that grandparents, aunts, uncles, friends that are doing the right thing by taking these kiddos in, literally within 24 hours can go from having been financially stable their entire lives to being Alice and completely financially unstable because they've taken independence. So we'll talk a little bit about how we're supporting that work with an organization called HALOS and our Changemaker grants and what that looks like. But it's a really important statistic, particularly in South Carolina, because such a large population of our children are living in a home with a grandparent and being raised by grandparents or aunts and uncles. Does that make sense? Okay, great. Then we're going to talk very quickly about home internet. In South Carolina, 24% of households below the ALICE threshold do not have access to high-speed internet. Let's say that one again. 24% of households below the ALICE threshold do not have access to high-speed internet. And you guys, that is a huge deal for us. A couple of reasons. With the increase of e-learning days in school systems, access to high-speed internet is more crucial to the success of children in school than ever before. And with 141,265 children in South Carolina having no access to high-speed internet at home, we know that academic performance is absolutely going to be impacted. I would offer that last week, this is a little anecdote for you guys, last week, or 2 weeks ago, I guess it was, when we had an e-learning day, we got that notification as parents at 9 p.m. the day before, 9 p.m. What are you supposed to do if you work an hourly job that has no PTO? You just don't get paid. Or you leave your kiddos at home in a not great situation. Or just like lock the door, do not answer it. Peanut butter and jelly is on the table. I love you. Please don't answer the door, right? But you have to pay rent. You can't not. And then we're expecting kiddos to get stuff done if you have internet or if you don't. There's also the kind of circumstance of like how many devices are in your household. So maybe you got 3 kiddos and 1 device. That's very common. I would offer y'all my husband and I have made the choice. We just have a TV in our household. That's just what we have. Much to my 6-year-old's chagrin, I'll be honest. And you know, when he comes home, I'm like, well, I guess you can use one of our laptops, but that's the option, right? But what does that look like moving forward for a lot of our households? How do they manage that, much less just not having overall access to internet as a whole in those spaces? We also know that how many of you, the organizations that you work with or have worked with, all of your applications are online now. That's how you apply. You can't walk in anywhere and drop off a resume or fill out an application in person anymore. And so if individuals and households have to apply online but don't have access to the internet, how are we expecting them to become employed and maintain their employment? And then how many of you, and we'll just do a show of hands, how many of you use MyChart? Oh, that's everybody, right? Everybody's on MyChart, right? So how do we maintain our health, right? If you don't have access to the internet, how are we accessing our lab records, contacting our doctors, getting our prescription refills? How are we regularly doing that? Because that's the expectation in 2024. Okay, so you guys have the ability to access and connect with this data. I know it seems like I told you a lot of things today, and I did, but there's a ton more. So this was just really, I promise, just a snapshot of all the data that there is. And also just one of the ALICE reports that we have. You guys can access this. Louise is going to follow up with everyone after this, both with a full report and emailing you guys links to where you can access this information and connect with it via the website. And you can access state and regional data. You can look at all kinds of demographic and household characteristics. You'll be able to look at year-to-year comparisons and be able to really connect with the data and investigate on your own. I would also offer that we welcome questions. You are welcome to reach out to any of us. I know that you can see all our little, as DJ calls us, our Brady Bunch heads. You can see all our little Brady Bunch heads, Ben, Justin, DJ, Bridget, Louise, Natasha. You feel free to reach out to any of us. We are more than happy to answer your questions, to walk you through this data and this work. If it's something that excites you, or you just are like, I don't get it, or I have a lot of questions, I need more information, that's the whole point. We love that. We love questions. We would love to walk you through anything. We would love to help kind of flesh that out. Is that fair enough? Okay. So what we're going to do now that you've listened to me talk a lot is talk a little bit about where your generosity goes. DJ is going to talk a little bit about our Changemaker grants and what they've done in the last year. And we're going to talk a little bit more about that specific organization, Halos, that highlights kinship care that we talked about for our kids in South Carolina. DJ?
Thank you, Katie. And as you can see, the data is very clear as to why we are going in the direction that we are. Not only do we hear from the community, it is a need in our nonprofit communities, nonprofit partners identified it as a need, but the board felt very strongly that we needed to support these individuals. And so last year, we decided that we would try to see how we could support our partners, nonprofit partners, in a much more targeted way than the traditional allocations process. That traditional allocations process has served us incredibly well over the last 30 years. But we were seeing some massive shifts happening very fast in the fabric of our community. Essentially, the costs have doubled over about a 12-year window. And so in order to be more nimble and to be more targeted, we took the muscle of the allocations process and decided to turn that into a quarterly grant cycle. And what that meant was that a more simple application so that nonprofits could be able to apply in a simpler way as well as track their data. But we also then said, looking at the data, where do we target these grants for the maximum philanthropic return on investment? And you'll see that a year ago, we rolled out one that was purely around capacity building. What is a barrier to you doing more in your mission to serve more people, to help lift more people up and really do that? And we funded everything from a $1,200 grant for a refrigerator at a church so they could produce fresh produce on Sundays to their parishioners, all the way up to strategic planning, staffing, trainings for staff, computer systems. In a medical clinic got transcription software. So instead of 20 minutes per chart, they could do it orally in 5 minutes, meaning they could serve more folks. Those grants don't exist very often out there. And so we did a very large grant cycle a year ago. In the fall, we focused it purely on ALICE and helping nonprofits go from the federal poverty line up to the ALICE threshold so that they could do more work and weren't limited by federal guidelines if they were a grant recipient. In the winter, we specifically targeted nonprofits led by or focusing more than 60% of their services on communities of color. And then the last cycle that we did was around the eviction crisis that's happening in the 29405, 29406. And so allowing those groups to help work with people to stay in their homes and prevent them from being evicted in those areas above the federal poverty line up to the ALICE threshold. We're in the middle of a cycle right now. Our board was very generous and said we needed to quadruple the dollars that were distributed purely around barriers to mission impact. We saw how impactful those were a year ago. And so I'm pleased to say that Tuesday, the application process closed. We have a group of volunteers who are now going through and blindly scoring those based on a rubric, and we'll be announcing those in a few weeks and getting those funds out. And they're one-year grants without a whole lot of strings attached. All we ask is that they fill us in on certain outcomes on the back end that we track pretty relentlessly as we're moving forward. And so we're very proud of that. We will be moving the Changemaker grants and continuing to evolve that around not only the data you saw today, but around the hardworking families that we know need to be supported in the coming months. And so we will continue those grants here in the future, the rest of this year. And so thank you. Your investments are truly enabling several dozen nonprofits to do a lot more of the work that they wouldn't have been able to do otherwise.
Awesome. Thank you, DJ. So talk a little bit about Halos specifically. So Halos is one of the nonprofit organization that received one of the ALICE specific grants. And this was a grant that was looking to focus on organizations that were willing to expand their eligibility to include ALICE households. So instead of their eligibility or intake process focusing on the federal poverty guidelines, or the federal poverty level as a guideline for income, they were focusing on the ALICE threshold, which was a higher threshold for income guidelines. And additionally, expanding their financial assistance to include categories from the ALICE survival budget. So those categories that we reviewed earlier, like childcare and transportation and technology. And so we talked to Halos after they received that grant. We've talked with them. We see them all the time because they're a fantastic partner, but we've talked with them recently specifically about that grant. And they have said it has literally changed their lives, because what happens is, as we mentioned, they're all about kinship care. Halos is. They are an organization that specifically supports on focusing or supporting families that are caring for dependents, but not receiving that financial assistance from DSS. And so they provide that support both emotionally and in parenting classes and in support groups, but also through financial assistance, things like Angel Tree, a lot of that work as well. But what they were running into was oftentimes they had money for things like rent or utilities, but not other things like childcare. And you know what you really need to do as soon as you get the dependents in your household, if you want to continue to bring money in the house, is get those kiddos in childcare. And so those are the things that they were able to do with the funds that we provided, was, be able to get kiddos immediately into childcare and do things like pay for the materials that they needed to start school. Because I'll be honest with you guys, that's incredibly expensive to pay for out of pocket to get all the school materials and backpacks and clothing. Because a lot of kiddos, I worked in a children's home for 6 years. I'll be honest, most kiddos come to you with nothing. They come to you with the clothes on their back. And you have to supply everything. Maybe the caseworker gets to the house at some point and brings you some stuff. But oftentimes they do not. And so we recognize that when you are responsible for now buying a wardrobe and all school supplies and everything that comes with that, all hygiene items, it gets really expensive, especially if you've got more than one kiddo. And so that's the kind of work that this grant is able to do, is support those families financially to be able to provide those kiddos with the support and safety that they need in such a really hard, traumatic time. And provide that support that those families need to stay financially stable when they're doing the right thing. So what we're going to do now is transition to Q&A and answer some of your questions. And so, Bruce, I have the answer to your question already. And so, oh no, did Bruce go? Oh no, I think he left. Okay, I'm going to answer it anyway, and then we'll follow up with Bruce on it. So Bruce asks specifically, what is the threshold for a single working parent with one child in Charleston County? And we have the answer to that. Again, composition matters. So I chose an infant for the age group of this specific kid. So this would be one working adult and an infant in the household. And that annual total would be $57,744 was what the annual total in the household would need to be. And that's an hourly wage of $28.87. And again, as a reminder, that is no savings. That is no loans. That is no extras. That is literally just month to month. So for a single person with one kid, that is $28.87. And we recognize that a lot of our single parents are absolutely not making $28.87 an hour. So what questions do you guys have? Go ahead, DJ.
Katie,
yeah.
do you mind if I share my screen real quick? Just wanted
Please,
to show
yes,
them where
I'll
that
stop sharing.
tool
Yes,
is.
absolutely.
So
ahead.
while Bruce was asking that question, I went ahead and pulled up the interactive site for South Carolina, which I included in the piece. And you'll see here, I included Berkeley, Dorchester, and Charleston County. The cool part about the tool is you can literally zero in on what counties and areas you want to see. And you'll see it has it sliced and diced for single adult, one, one child, one adult, one in childcare, all the way up to 2 adults age 65 and older. And you can, again, pick any type of county level you want, city level, and go in and massage the data. What I really love is right down here below. So in this case, you can pick out which counties you're interested in. In this case, I picked a senior citizen and 1 child in childcare. And here's the budget if we're talking about one of those grandparents or aunties raising a grandchild. And so it's an incredibly powerful tool to be able to go in and explore, and urge you all to do that. We included the links in the chat for those who want to do this. And you can see the entire state is here, as well as all of the sources where they came from.
Perfect. Thank you, DJ. Any additional questions?
Well, as Katie indicated, we are more than happy to continue to engage in dialogue, help share any info we can, and answer any and all questions that you have. We're also incredibly excited to have Bridget Laird joining us. What is this, your 8th day or 9th day, Bridget, with us as a employee? Bridget had done amazing work at Wings for Kids and has come over and has really hit the ground running. And so we would love the chance to come by with all of you, share a little bit more as we're moving forward on this journey, and continue to get your feedback. And so, Bridget, anything you would add?
Yeah, like I said, like DJ said, I've been working with kids in Charleston for 26 years, and this data to me is daunting. I mean, I think it's great, the work that the United Way is doing around bringing the data forward so that people can see it and understand the impact within the community. And I'm excited to be at the United Way at a time when we're really moving forward in a way that can help the families in immense ways. I'm excited to meet everybody that's on the call again, 8th day, so getting there, and I will be out there moving and shaking and ready to meet everybody. So thank you so much for attending the webinar and learning more. Katie's awesome. She's the data queen in terms of Alice, so I hope that you all enjoyed the way that she walked through all of the data.
Very helpful. Thank you.
Yeah, absolutely. And Meryl, you unmuted. Did you have a question?
No, I'll go back to the data.
Okay, no, you're good. Yeah, and I'll put my email in the chat box in case you want to follow up. No worries, that's fine.
Okay, great. Yeah,
That's
it was
helpful.
just some specific questions about some of the internet stuff, more of the gross numbers, as opposed to the comparisons between the groups. But
Yep, just shoot me an email and I'm happy to walk you through it. And if it's like ultra specific, I can always reach out to the research team at our larger United for Alice National group, and they those with doctorates get smarter than me.
yeah,
So,
no,
yes,
it's good.
happy to.
I find it interesting when you're breaking down the different buckets. I think that's how it's helping me look at the whole situation from how can we help. I think those buckets help. So where are we driving
Yes.
metrics inside of each of those things? Transportation, internet, technology. I'm just trying to visualize. It's a lot to take in, and you think, how can you help? It's a very broad spectrum. So just at a flash, I was thinking it'd be great to see the metrics broken down into the same categories of how are you moving people's budgets up and down according to those categories. So.
Yeah, Meryl, I love that you say it like that, because that's certainly what we're finding, especially like in our resource connection centers. Like, it's really good to help people in crisis with rent or utilities. But if the cause of the rent not being unable to pay your rent and utilities is you can't shift from part-time work to full-time work because of a lack of childcare, we really need to solve the childcare problem for you, not continue to just pay rent, because that won't solve anything. So I really like that you bring that up. That's really helpful. Love that. Okay, awesome. Well, y'all have been great today. Louise, Bridget, and DJ are going to follow up with some meeting requests to you guys in the next couple of months to discuss the future of TUW and how you guys might want to help. So think about it. Like, I love that Meryl said that. Like, just think about what that means to you and where, what the data means, any of our staff would love to talk more about the data with you and how it pertains to where you're at. So thank y'all and hope you have a wonderful day.
Thank you.
Thank you.
Have a great day. Thanks.
Yeah, thanks, everybody.